Welcome to UNC Greensboro's Speech and Hearing Center. Now we're going to give you a tutorial on how to do a tympanogram.
So after you look in the ear and make sure everything's clear, you're going to do tympanometry. So first thing you need to do is make sure that the machine is on. And while looking at the screen, you can see that right ear is red, that left ear is blue. So make sure you select the correct ear that you're going to be looking at first. The next thing you need to do is pick out a tip that fits your patient best. So I have this red tip on here. So now I'm going to set this on your shoulder, and I have the right ear selected. And I'm going to fit this into your ear. All right, now I'm going to let Dr. Myers tell you about the test results.
So after you have completed tympanometry on both ears, you're going to come and look at the results because you want to let your patient know if everything seems to be going okay with the middle ear. And so looking at the right ear that was just run, what you want to see is if you have a nice little peak here that's within this box that's considered your normal range. And we do have a nice little peak in there. So the eardrum at rest, movement, back to rest. So we already know that that's healthy. Then we're going to look at some measurements. We're going to look at the volume. So that's making sure within the cavity that maybe you're not up against something. If it's a low number, you might have wax in the ear. You, as the clinician, could be up against the ear canal. If it's a really large number, there could be a hole in the eardrum. So that definitely gives you some information. Then you're going to look at the pressure of the peak. You would like it to be anywhere from about positive 100 to about negative 150. That's considered normal. If it's too far this way, too much positive pressure, that means your eardrum is pushed forward. And if it's too far this way with negative pressure, that means your eardrum is sucked back. If it's really sucked back, that could be considered a type C tympanogram. And then when you come here to your compliance, that's just the mobility of that peak. Where is that peak? If it was outside that box and down here, that would suggest that your ossicles are a little bit stiffer. And if it's way up here outside the box, that would be considered disarticulate. So the ossicles are moving too fast. So then you would classify those as an AD for too mobile, or an AS for too stiff. So it's moving, but not quite within normal. If the line was completely flat straight across, that would be a type B, which would indicate possibly ear infection fluid, keeping the eardrum immobile. And then if it's normal, you come and you select A. A means that we're normal and this eardrum is moving normally. So it is type A.